Hello everyone. Today we will see how to approach to murmurs when we are examining a cardiovascular case. Mainly chapter number 42 from Harrison, approach to murmurs. So the main thing here is the timing of murmur. That plays very important role when we are examining the patient. So we know that there will be S1, S2. It will repeat again. So this phase is systole, and this is diastole. So when we are examining the patient, when we hear a murmur, first try to find out the timing. Focus on whether it is systolic or diastolic. That is the most important step to find out the causes. So we'll see now. Suppose the murmur is clearly localized between S1 and S2, first and second heart sound, we will consider it as systolic. If it is coming after S2, then it is diastolic. We know that diastole is a phase where ventricular relaxation will happen. So just imagine ventricle is relaxing with the arms stretched. So it is relaxing ARASU. So just remember, it is the relaxing phase, that is ARASU. Okay. Or you can just tell ventricle is relaxing with stretched arms. So just remember this one. So why we are focusing on this word diastolic murmurs? There are mainly two things. One is early diastole, second one is mid diastole. So when we hear a murmur after S2, focus whether it is early or mid one. So if it is early, always consider chronic AR as the cause. So this is early diastolic murmur. If it is in the mid diastole, then you consider mitral stenosis as the common cause, mitral stenosis, if it is in the mid diastole. And once we got this point, we should also consider the friends of these lesions. That is, mainly here we are discussing about left-sided lesions. But when you hear the murmur, you should also consider the right-sided lesions for the same timing. For example, AR, the right-sided counterpart will be pulmonary regurgitation. Whereas for MS, you can consider tricuspid stenosis. Like that, you have to think of the friends of these primary lesions also when you got the timing of the murmur. And remember one thing, mid-diastolic murmur, commonest cause is MS, but there are 8 to 10 other causes of mid-diastolic murmur that I will discuss in some other video. Then coming to systolic, that is, we are hearing murmur in between S1 and S2. And remember one more thing, when the murmur is clearly audible, like you will not have primary confusion when you keep your stethoscope for the first time. That will be usually systolic. But when you are in confusion, like the sound is not that clear and you are not getting the point properly, usually it will be diastolic. This is just a clue, not the rule again. So we will discuss systolic murmurs now. Systole is, we know that, ventricular contraction. So systole is what? Ventricle is contracting and doing more action. And in that too much hard work, ventricle is getting marasmus. You know the marasmus, like the malnourished individuals. So we'll just imagine the situation. Systole is ventricular contraction. So because of this hard work, ventricle is getting marasmus. So we'll focus on this word now. Again, in systole, early systolic murmurs, mid systolic, late systolic, and some will be holosystolic. Like it will start from S1 and it will be occupying till S2 levels. So we'll see now. Early is commonest cause is mitral regurgitation. So this is early systolic murmurs. And remember here, this is acute MR, not the chronic one. About chronic MR, I will be telling soon. So this is early systolic murmur. And we have to always remember the friend of these primary lesions. So MR, the counterpart on right side will be TR. Again, acute TR, but usually will not see such condition. Coming to mid systolic murmur. Mid systolic murmur, so the word is AS, that is mid systolic murmur. Commonest cause is aortic stenosis, and the friends of aortic stenosis are pulmonary stenosis on the right side, and it has one more best friend, that is HOCM. This we should not forget. Hypertrophic obstructive cardiomyopathy will also lead to mid-systolic murmur. And late systolic is mitral wall sealing. So just remember mitral, this U we can write for wall, sailing. Mitral valve is sailing like a boat. So that is seen in mitral wall prolapse. This will lead to late systolic murmur, but here clue will be there will be ejection clicks. Ejection click will be associated. So hope you got the point about systolic murmurs. And I told there are some murmurs which will be hollow systolic. So for hollow systolic, most common cause is chronic MR. Counterpart again TR we can consider. So these are systolic murmurs. Then one more type is continuous murmurs. Continuous murmurs can be physiological as well as pathogenic. So here continuous murmurs, the meaning is these will occupy both systole as well as diastole. They can occupy the complete phases or part of phases, but there will be murmur in both systole as well as diastole. That's why they are called as continuous murmurs. Commonest examples are patent ductus arteriosus, arteriovenous fistulas, commonly created for hemodialysis, venous hum, even mammary shuffle. These are some reasons for continuous murmurs. So the overall point is, main thing we have to focus in murmurs is about the timing of the murmur. So first to decide whether it is systolic or diastolic. For diastolic, just remember it is ventricular relaxation with arms stretched. So the ARMS, these are the two things, early diastolic, mid diastolic murmur. And whenever we are thinking of primary cause, we have to see the counterpart on the right side also. Systolic murmurs, ventricle is contracting too much hard work leading to malnourishment, marasmus, mnemonic. So based on that we can see whether it is early systolic, mid systolic or late systolic. Then hollow systolic murmur, chronic MR, continuous murmurs, these are the reasons. So once you got about the timing and probable cause, you can focus on other components of murmur like the intensity, grading 1 to 6 in systolic, 1 to 4 in diastolic murmurs, and the radiation, conduction, and some maneuvers like change with the respiration, hand grip, Valsalva maneuver, all those things are there. Those things will definitely add on to come to a conclusion, but the main thing is the timing of murmur. So hope you got the point. Remember diastolic arms, systolic marasmus. Thank you so much. See you in the next video.